to be able to unmute, to be able to share your thoughts in the chat. This is a safe space, once again, as I'd like to emphasize, and your voice matters here. So thank you so much to the people who are joining. Before we move into the program, we're just going to be playing a very short video. And as you watch this video, I would encourage each and every one of you to show what resonates with you and share your own experience. Show us what's standing out in the video or in your experience as a migrant in general. And on to Tendai. Our amazing Tendai is here helping us with the tech-related support. And he will be playing the video.
I'm the founder and CEO of Tulia, a community interest company that supports migrants. My heart is to help migrants with law, legal advice, helping them to navigate the complex immigration rules, but at the same time supporting them through that process.
After I met Tulia, they've made everything easy for me because
I can't hear.
to get a job.
She helped me get accommodation until I gave birth to the twins. She advised me, helped me to settle because I was really paranoid. I was scared. I did not know what to do.
There was no one to help me, no one to assist me. So Tulia assisted me a lot with a lot of information which I could never ever heard of.
We care about our customers. All of our team have got lived experience as migrants. So there is an understanding of the journey that is something that you don't have to explain, but we just know because we've walked that journey. And we have a proven track record with over 30 years experience collectively in our organization.
Thank you so much for playing that video. I hope the video was audible enough, and I hope the experiences that our fellow migrants have shared resonates with you. And welcome back to everybody once again. Those who are meeting us, we are the Tulia Group, and now I will be delighted to hand it over to Mrs. Rumbi to give us the opening remarks. Over to you, Mrs. Rumbi.
Thank you so much, Ketina. Thank you. Yes, my name is Rumbi Funzawabaya. I'm founder and CEO of Tulia. And we welcome you to the launch of Changing the Goalposts report. So this report, we did this report because we were increasingly hearing the fears, the frustrations, and the experiences from migrant care workers across the UK, and people who came to lawfully to fill critical shortages in the care sector, but who now feel that the rules may be changing after they've already built their lives and made plans around the promises that they were given. The report was designed to give migrant care workers and their families a voice at a time when major immigration reforms were being discussed publicly. And a lot of times we found with the people that we serve, I think the first video was there, was there to just highlight some of the work that we do and to introduce us as an organization in terms of the work that we do on a day-to-day basis. So as we hear the voices and we hear people speaking to us, and also in their own groups and in their own social circles, we then decided to take those voices and to hear them clearly and loudly and put them together. And so we teamed up with an academic, Hilary, who's going to give the findings from the report. we decided to just do some research around this area and to hear the voices and to document what workers themselves were experiencing, and not to leave the conversations on WhatsApp chats or to leave the conversations on Facebook as comments, where people are frustrated, are sharing their frustration, their experiences. People share these in spaces where they cannot be heard by decision makers and the people who need to hear it, stakeholders. So we wanted to document what workers themselves were experiencing and how they understood the likely impact of the proposed settlement changes. And the research was necessary because the proposed reforms do not affect immigration status alone. They affect family stability, they affect well-being, mental well-being, they affect children's futures, career progression, workplace exploitation, and long-term integration into British society. So the report highlights that many care workers already feel trapped by the sponsorship system. They're unable to change employers, they're unable to challenge unfair treatment because their visa status is tied to work. So the thought of this carrying on for 15 years is cause for great concern, mental health crisis. We have people who are struggling with these proposals, which are being discussed publicly and across all different media forms through the news every time. They're hearing all of this news all the time. And extending the settlement routes was seen by many of the respondents in this research as extending insecurity, as extending dependence, rather than rewarding contribution. We also did this report because migrant care workers have become essential to the functioning of the UK adult social care system. I attended A&E last week with our daughter. And whilst I was waiting there for 7 hours, I saw many people come in and many people come out, and I saw who was working. I heard different accents from different countries. I saw people of different colors, people who are British, people who are Indian, Pakistan, Kenya, Zimbabwe, Philippines. The majority of nurses and carers who were there looking after us were migrants. And I realized just the impact that migrant care workers have. They're essential to the functioning of the UK adult social care sector and the NHS and the hospitals. But there was very little research centered around their lived experience on these proposed reforms. And policy decisions are being debated, and there is evidence that has gone, but there can never be too much evidence. So we need to hear all of the voices, and decisions have not yet been made. So at its heart, this report is about fairness, it's about trust, it's about the legitimacy of policy. Many respondents said they accepted that governments can change immigration policy. The governments can change, we know that they can. But what they strongly opposed is the retrospective changes for people who had already entered the UK under a different understanding. And as the report itself says, we believe that good policy starts with listening. And this report is about our contribution to that process. And the report is moving the goalposts, the impact of proposed UK settlement reforms on migrant care workers. And that's what we're here for today, and to share from our findings, to share some of the lived experience, and to have time for question and answer, and just to talk about it, and then to map out the next steps and what we're going to do going forward. So thank you. I'm going to hand over now to our moderator so that we can have Dr. Hilary. Thank you so much, everyone.
Thank you for that concise yet informative opening remark, Mrs. Rumbi. We truly appreciate that. Thank you for sharing your thoughts. And it's amazing to see people getting involved in the chat, sharing their thoughts, greeting one another. It's such a joy to have you all join us again this morning. Thank you. Next, we have Dr. Hillary, the researcher who worked closely with us on this report, and he has helped us analyze the data, interpret the findings, and shape the recommendations. So, he will now walk us through the key findings, the human impact of this report overall, quotes from participants, and the recommendations that are emerging from the evidence. And as Dr. Hillary speaks, let us who are in this meeting feel free to drop what findings hit us hard, what research aspect makes us relate to the thoughts of the participants the most, and what changes the policymakers must be aware of. So, Dr. Hillary, over to you.
Thank you very much for the introduction and for putting us into the presentation. There are, as has been said, these findings are pretty much. There's someone who's also speaking. If you could mute, thank you. Can you hear me?
Not very clearly. You sound a bit muffled.
Oh. Okay, because actually the reason why I'm muffled, I'm speaking my loudest, but let me.
We believe you might have gone on mute, Dr. Hillary.
I don't know how that happened, but
okay. Let me switch to my. Now I'm sure you can hear me.
Yes, we can hear you clearly now.
Very well, yeah.
Okay, I'll use this device to speak to you. So like has been said earlier, this report pretty much voices what people are saying. So it should resonate to everyone who participated, or even if you didn't participate, I'm sure you'll identify with a number of the findings that we made. If we can move to the next slide, thank you. Yeah. So why now? Why are we having this report now? I think it's clear that the proposed changes are already affecting us. They're affecting those who hold work visas and are due to apply for settlement extension. And it is not clear whether these are going to apply retrospectively or not. But I think it does speak a lot to how those who are already in the country perceive this in terms of the original terms and how they thought things were going to happen when they came, right? And I think a lot of migrant care workers are the ones who are affected because and many of them came in between 2021 and 2024, and some came in 2025. So those are the ones who are very, very much affected. Can we move to the slide on the findings? Thank you. So what is it that people are saying? I think one of the key things is that there is care workforce instability with around 65% or more considering leaving the UK altogether. And now that is going to inevitably deepen staff shortages for councils and for the sector. And I think we do admit or agree that the sector cannot afford to lose people. due to this. And also there is an aspect of migrant exploitation, with 73% feeling that they cannot leave their work due to visa risks. You know that leaving means that you need to look for sponsorship elsewhere. And with the way things are right now, it's difficult to move. And also, I think another issue that's going to be perpetuated by this extended ILR route is that people are working in poor conditions, so there is going to be a perpetuation of hidden exploitation, and also the long hours, the fact that people cannot voice their dissatisfaction or any issues at work with the risk of losing their visa. So there is going to be prolonged migration exploitation. There's also an anticipated family separation, with 91% of the participants indicating that this proposed route is going to affect how their families are going to integrate or to be settled, because as you might know from what is proposed, the dependents will also have their own different qualification criteria, which could mean that families might get settlement, if at all they are granted settlement at different times. So that is also perpetuating family separation, and also children's welfare and community integration. They are children who will age themselves out of dependency. I mean, children who came in just before they turned 18, if this is extended, that means that they're going to go way into their 20s as dependents. And now that also affects how they are going to start their own independent life and their own families. So there is a great impact on family separation and the family in general. And then I think another key finding is the mental health challenge that this whole white paper and the pronouncement has brought, because I think 95% expect a negative mental health effect and are already experiencing this. There is a lot of stress and anxiety given the uncertainty that's there, and this also would lead to challenges around work performance itself due to the mental health stress. There's also anticipation for increased financial health, financial impact with more costs incurred by families. As you can see, one person really did indicate that switching is a nightmare right now, and if we go with the ILR, the extended ILR route, switching would even be worse. Can we move to the next slide, please? Thank you. And I think the evidence is coming from people. These are the voices. This is what people said, right? And there's aspects around going through modern day slavery, and and that is also perpetuated given the scenario that with the current visa regime, you are stuck to an employer. So with the extension of this the settlement route, that means that you are stuck to one employer for more than 10 years if it goes that way, right? There's also aspects around mistrust, because people came believing that they're going to build a life here, but then things are changing. The goalposts are shifting, as the report says. So now the question is, what do we do when there's this mistrust? People will think of moving abroad, but also people are not saying no, don't put the changes, but they're also saying that, look, listen to us. We're okay if we stay on this 5-year plan, but maybe uh, give us indefinite leave to remain. We're not going to claim benefits. I think because I think there might be an issue that once you get indefinite leave to remain, you are entitled to benefit and all. And a number of people pointed out that this is not their case. This is not their intention. They don't want to end up jumping onto benefits. They just want to be able to work and settle their families in a, a, a system where there is certainty, and it's not an issue of what is the government going to do next. So this is what people have voiced out. I would also urge you to read more into what's in the report, because it has strong narratives that are coming from individuals whom we spoke to around the impact this has on them. If we can move to the next slide. So what is the impact of this whole settlement regime? It shouldn't be seen as something that is only affecting one side. So the impact cuts across sectors. For example, if you look at local authorities and commissioners, workforce exit are going to accelerate. So a lot of people are going to leave, and these costs need to be carried by local government. They need to be carried by agency staffing. That means there is going to be more pressure on local government budgets, and there's also going to be more pressure not only on the workforce, but local authorities also need to deal and address these health challenges that are coming, the mental health that is also coming as a result of these proposed changes or the extension. So it needs to be looked at from that angle. In the care sector itself, uh, the sponsorship that is already functioning as a labor control mechanism is still going to be perpetuated, and we're increasing exploitation risks, and then there's also demand now for immigration advice for those organizations that are supporting migrants. There's demand for mental health support. There's demand for family crisis support. That also means that both local and central government would need to divert funds from other programs to now try and address these pressures. And then, like we said, children are going to age into beyond dependent status. So what then happens to the child in between the period where they are waiting as a dependent for a prolonged period? Are they still going to use or access the education system, and what's going to be the financial implication for that? At the end of the day, what are the recommendations? So the evidence that is coming out is giving us the next 6 recommendations that I'm going to talk about, and maybe if local authorities, government, and all the stakeholders involved can take heed of these 6 recommendations, I think the message coming from this study will have hit home. Can we move to the next slide? Thank you. So the first recommendation is that there should be a guarantee of full transitional protection for those already in the UK. So yes, you can enact this new settlement route, but let it not affect those who are already in the UK. That's the first recommendation that's being given. The second one is also introduce a breeding status for workers who are already here so that they can be able to leave exploitative sponsors. So maybe the visa is not tied to a worker, but it could be to an employer, but it could be tied to the sector. So people can move around employers in the sector without losing their visa sponsorship. The third recommendation is to treat family settlement as a central policy domain, not to treat it as a secondary attachment. That way, whatever decisions are going to be made will also prioritize families and dependents who are already in the UK. The fourth recommendation is also to target enforcement where structural vulnerability is concentrated. So there are areas where we've seen that the system exposes people to prolonged and additional exploitation. If also enforcement and support could be seen in those areas, because I think there are major safeguarding issues that are emerging from the findings. If there is enforcement put in place, people can also be protected. And also there is need to decouple lawful residents from excessive employer power, because the employer at the moment has got a lot of power, which leaves the employee at their mercy. And the final recommendation is clear communication, because we have not had clear communication as to what exactly government is going to do with this reform, when it is going to happen, and how it's going to be done. So clear communication and legitimate transparency is also recommended. And we hope, armed with the evidence of the overall impact across different areas, that this report can then provide support to a voice that sees those who are already in the UK getting a better deal from this proposed settlement routine. Thank you very much. I'll hand over back to the moderator.
Amazing work, Dr. Hilary. Thank you so much for giving us that insightful point of view as a researcher. Thank you so much for helping us and assisting us with drafting this report. It was great insights that you provided us with, and we can also see people engaging in the chat as we went through. Stella has mentioned the issue of dependent child is disheartening. It is very disheartening because it is children that we're dealing with, and it is for the children that we're wanting to establish a good future. And suddenly seeing all these changes affecting us and our children is indeed disheartening. And yes, of course, we will ensure that everybody who attends this meeting gets access to the report. Those who registered through Eventbrite, you will definitely be able to get access to this report. If not, you can go on to www.tulia.org.uk and explore our website and see, get access to this report. If not, you can also alternatively email us at info@tulia.org.uk and request for the report, where we will send it out to you personally. Liberty has also mentioned the report is pregnant with the experience of the carers, and Liberty has gone on to say the human aspect of being a migrant worker here, where we are settling into the UK, we've already got our mortgages, we've already got our expenses all sorted, and suddenly having to pause them all. It's just that we have to urgently bring all these policy recommendations that Dr. Hillary has just ran us through to the attention of the government, and we will be able to do this together as we work hand in hand, empowering one another and informing everyone about how migrants support the country. And also, on that note, we shall be moving on to the lived experiences. So, as of now, we've seen the statistics, the key findings. Now, we shall move on to one of the most important parts of today, the lived experience. We have three carers here with us. We won't use their names today. We're going to be excitedly asking them to introduce themselves. I shall refer to them as person A, person B, and person C. And three of our friends here will share briefly about around 5 minutes. They're going to be sharing how the proposed earned settlement reforms affect them personally and what these changes mean for their families and what they want the people, the government to understand about the reality behind these statistics. So, as we move on to the next part, I invite every one of us in this meeting to reflect on what emotions come up to us. You can even add that as an emoji on the chat, or what you wish for the policymakers could directly hear from us, migrants, workers, carers, people working in the NHS, what we wish for the policymakers to directly hear from us. So, person A, I would love to invite you. I'm opening the stage to you. We can start with you. Hello.
Okay, apologies. I'm not too sure if oh yes, you can go ahead, please.
Yes, so person A, as we decode the mystery, we would love for you to come forward, unmute, and introduce yourself and share us
Um,
your experience.
is it good afternoon? Is it already afternoon? It's morning.
It's morning.
Yeah. I think the report came at the right time. Maybe before the proposed changes are put into law. I would, if I could find maybe an ear with the policymakers. I've got um, lived experiences that I think they need maybe someone to listen to. If you read the issues why they want to make policy changes in the immigration policy, one, that there was a Boris wave of people who came from 2021 up to 2025. We are being treated as just mere statistics of a wave. We normally see a heat wave, something which is not right. Um, Maybe it's a sea wave. Sea waves, they are treated maybe as dangerous. So, to policymakers, we are an unwanted people, so to speak. You discover that there is a characterization of something that is not desirable to the host. And if you read much into the body politic, what politicians are saying, you discover that some sectors are becoming, known for only one policy. Their policy is about migrants, whether legal or illegal. We came here at the invitation of the government, whether it's the previous government, which they think maybe they made bad decisions. But we are human beings. We have got families. We have got children. And our dependents are not just seated at home, they are working. We also have our own children who are aging beyond, soon beyond being dependents. They are becoming adults. They are going to college. They are paying their own fees. But in that aspect, there are also issues of sponsorship that makes our children not be able to work as much as they want, because they will soon be treated as no longer dependent, and they need to maybe to find their own route to settlement. I think there's also another aspect that the policymakers are not seeing. They're saying most carers, they are people who are below, who are working in a sector that is not paid much. We don't set the minimum wage for carers, and also not all carers are people who are working maybe with A level and below. We have got people who have got master's degrees. We have people who have got doctorate degrees. So to us, the proposed changes are meant to tie us to one job, being a domiciliary carer. I cannot change my job, irrespective of my high qualifications. I've got potential to move from a low paid job and get a better job and maybe contribute better to the economy, contribute better to my society. So we are saying if the policymaker is afraid that when I get indefinite leave to remain in the 5 years that I came here under, why are you not putting a new policy to say those who are going to get indefinite leave to remain, people who came from 2021 up to now, if you get your indefinite leave to remain, there's no recourse to public funds, because as we speak, we don't have recourse to public funds. But unfortunately, we are treated as foreign students. If I want to go and advance, or if my child wants to go to college or a university, they are treated as an international student. But we are treated as an international student who is paying tax, who is uh, paying VAT, we are paying NI, we are paying health surcharge, but still we cannot benefit from home fees. We cannot advance. And also the nature of our jobs. You don't have time to go and read. You don't even have time to go and attend a lecture. We have taken a lot of effort just to attend this launch. So I think there is lack of a human element in the way that the message is being shaped across. The way the policymakers are communicating, it's like they are just talking to people who don't matter. Maybe is it because the health and care sector is viewed as a non-productive um, element of the economy. But we are dealing with human beings, the people that we look after, where we work. We actually work with people who are vulnerable, the sick, the elderly. We give them comfort. But the way how the message is being transmitted, it leaves a lot to be desired. Thank you.
Thank you so much for pouring your heart out, Liberty. Thank you so much for being vulnerable to share your experiences and to help us understand that the policymakers are viewing migrants just as a statistic, but they do not see the background efforts that we migrants have put in. We've made this choice in our home countries to be able to choose this country, to be able to have a future here, and the policy makers, we feel that they're robbing us off of this choice. And I really like the way how you put heat wave, sea waves, how these waves are all natural. But then we've had political waves like the Boris wave and various other waves that are coming into just give us more and more uncertainty about the future. And I also really like the fact that you mentioned how many of us are very highly qualified with master's degree, with a PhD. We are researchers, and though we are heavily qualified, for the only reason to stay in this country and to live here, to build our future here, and to build our families here, we are robbed off of that choice to be able to choose the jobs that fit our degree. And we are restricted to mostly work around domiciliary care or the NHS and places like that. So thank you so much, Liberty, for that. And moving on to person number two, who is willing to share their lived experience and what their reflections are in terms of the proposed changes and the report that Tulia has put forward. Opening the stage to you, person B, as we decode the mystery.
There's Agu Valentine.
Hello, Agu Valentine. Hi.
Yes. Yeah, hello. Good morning, all.
Good morning. We would love to hear your thoughts, Agu Valentine.
Yes, thank you very much for this wonderful section we are having today. You see, my own experience, all of us are having different experiences, but we are all trying to make one suggestion at one point. You see, currently I'm 3 years and 7 months on healthcare visa. You see, my first 1 year sponsorship. Then I got a 3-year contract, which ended on 6th of this month. You see, then as I speak to you now, I don't know my left from my right. I don't know what to do. You see, the company that gave me 3 years, I was trusting them, hoping on them, believing that all is well, that I will get my extension. But to my greatest surprise, they just gave me 1 month notice that they won't extend, you see. And I have family here. I've gotten myself a house on a mortgage, hoping that this 5 year will work and, will be, we'll settle down after 5 years. But currently, what the proposals is trying to bring will automatically, you see, mess not just me, 80% of migrants up, because everybody is hoping on these 5 years to settle down, because what we are passing through in the hand of our employers, more especially the domiciliary care workers. You see, I don't wish my enemy domiciliary care work. I don't wish it to my enemy once you are working under visa. Not that domiciliary care is not good. It's very good, but they will treat you fine once you are not seeking for a visa. But once they have given you sponsorship, they will just not just I will not use slavery. Slavery is better to what they do to people. You see, leaving your house 2 o'clock in the morning, coming back 11 p.m. in the night. On your off day, your employer will be threatening you about your visa. If you want to take your normal day off and they want you to go and work, they will tell you, remember, you are working under a visa. Your COS up, COS down. We don't have our life here working under visas. Tying these visas to employers is one of the, you see, it's very bad. They give them power to treat us as they want, as they wish. Sometimes you don't get paid for what you have worked for. You see, so I will, if they can do the visa not to be tied to the employers, you see, it will help very much well. Even if they're extending the 5 years to 10 years or 15 years, they should give us a free visa. Once you can generate a working a share code under a skilled worker,
Yeah, many
they will
you won't know
yeah, they should be more concerned in people paying tax. You see, meeting salary thresholds, not visa. This visa tied to employers is just a mess. Thank you very much.
We can't hear you, Kitna.
Hello, am I audible now?
Hello, I think I have finished.
Yes, you
Yes.
are. Thank
Yes, yeah. Thank you so much for sharing that, Agu Valentine. Thank you so much for sharing your point of view. And Stella here is also engaged in the chat saying what you've iterated there. Reduced to statistics, labeled a wave while our humanity drowned beneath the headlines. Well said, brother. Thank you so much for reiterating that here. I'm sure many of us are able to relate to that. And just like how you shared your frustration with regard to the visa, just the word visa, just the title visa, just us being reduced to statistics. It is very reflective, and thank you so much for again coming open and sharing your thoughts over here. We have space for one more person to be able to share their point of view, their reflections, their thoughts on the changes that the government is imposing on migrants. And I will leave the stage open to you. Is anybody else willing to share? Yes,
Yes,
Oma.
I am.
Hello, Naomi.
Hi.
Hello, Naomi. We are excited to hear what you've got to say. Hello.
Sorry, I didn't realize I was muted. I was
Yes,
saying I
Naomi.
would like to thank each and everyone for the contribution and for Rumbi for creating this platform where we would express ourselves. And I would like to agree with everything and everyone that has shared. It is very true that is what we facing. But one other thing that I would like to add on top of each and everything that has been said on this platform is that as immigrant workers who are on COS, we have been devoiced. We do not have voices at our workplaces. And anybody that seems to have a voice or that seems to speak out, you face serious victimization to the extent of being fired, to the extent of being trapped, or to the extent of being set up to make sure that that goes mute. So it's an appeal to the government that whenever they are bringing up immigration as something that is useless to them, they should also understand the pressure that they are putting on us as human beings, because at the end of the day, you are forced to take whatever comes your way because you have no voice. If you want to speak up or you want to do anything, automatically you become a bad person. Automatically you become not a good employee. So we are not able to exercise our human rights while we are working under COS because they know we are vulnerable. They know we can't do anything. They know we are, some of us, we are actually clueless as to how do I go about it if I feel like I'm being victimized for speaking up. So these, among other things, are the things that also they need to take into consideration when they are making their policies. We are devoiced. Our voices are muted. Thank you.
Thank you for sharing your thoughts, Naomi. And you are perfectly right. Many of us feel devoiced, especially when we are on skilled worker visas. We sort of become like this third person, exactly as what you've quoted. And we don't stand the same sort of treatment or the rights that the local employees, that British employees stand. And we become vulnerable, yes, because we are not aware of our rights and we do become clueless. Just like how we mute ourselves here, how we go on mute on Zoom, how we unmute. These people do not realize that they are dealing with lives and they're muting our voices there. So thank you so much for sharing that. But that's why we exist. We, as Tulia organization, our vision is to be able to bring out the voices of the migrants, and which is also one of the main reasons why we got into research, why we interviewed many participants on their experiences and the impact that the Home Office and the government are putting forward. So please join us in this journey as we all go hand in hand and work with one another. And let's keep sharing our thoughts. On that note, I'd like to thank each and every one of you, Liberty, Agu Valentine, and Naomi, as I will pass on the moderation to our wonderful Tendai here. Tendai will be helping us lead the Q&A session where we have our panelists here, who is Mrs. Rumbi, our founder and CEO of Tulia, Simon Vasey, who is from Coventry Council, he is our commissioner here, and Chennai Machinjike, who is from EPAC UK, who is one of our parenting organizations at Tulia. So over to Tendai. Thank you, Tendai.
Thank you so much, Keaton, for taking us through. That was brilliant. And thank you, everyone, for joining today. And thanks to our panelists. We still have got time for questions, for answers, and for contributions. So we're just almost there. But allow me to welcome Simon, who is a commissioner at Coventry City Council. We work with him so much. He supports Tulia so much. And Ruby Zaivan Zabaya, our founder and CEO for Tulia. She's a solicitor. And also Chennai Machinjike. She is a social worker and she heads an organization that supports parents. And also Dr. Hillary, who has been our research consultant for this report. So welcome to everyone. But I'm going to do this by probably starting off with Simon. If you can just share your contributions, what you think, from your position of influence and what this report might mean for you, and any thoughts that you might have. Over to you, Simon.
Apologies, I've got very little voice. I've got a chest infection, so I'm struggling a little bit. Yeah, very interesting. Obviously, I can't get involved in the politics, in national politics or local, really. But what I do get involved with is many international workers at a local level who live and work in Coventry or importantly don't work in Coventry for one reason or another. And I do echo all the problems. We've tried in Coventry to try and make things a lot easier for those workers who are unfortunately not working due to many reasons, but also those who are working. And of course, those who are working are often invisible because guess what? You go to work and we don't see you. So we've tried to keep in touch with as many people as possible, and we will continue to do that. We were very blessed in the first couple of years, both myself and my colleague Lynn, who works in Warwickshire County Council, of having some money from the Department of Health to support international work. That's largely gone now. There is some legal resources available from regionally, and I can share those details later. But locally, we've been providing the drop-in with Tulia, which has been wonderful and great to work with these guys as well. They've been inspirational, which is really good. And I know they have everybody's best interests at heart. We're still doing a lot of work with employers around improving terms and conditions for people. That's what we do as a commissioning team. We don't just look at the service delivered to the people in the clients. We look at the service delivered to the workers and improve the outcomes for the workers as well. And we will continue to do that. And I'm sure Warwickshire County Council will continue to do that as well. But yeah, I mean, I'm happy to answer questions if I can still talk. But I can't really engage in kind of political stuff because I'm kind of politically restricted, so I'm not allowed to do that. But, I do listen and I do hear what you say, and it's very important.
Oh, thank you so much, Simon. And for signposting us in the right directions. We will take questions. So if people have got any questions at all, please do drop them in the chat. Oh, and by the way, also on the panel, we've got Danai, who's representing the employers, They've got a wonderful organization called Health and Social Care Providers Network, which combines most of the health and social care providers, and they meet to discuss, the issues that they're facing and way forward. So she will also get a chance. So now I'm going to ask Chennai from EPAC to maybe share her views and thoughts on the issue today. Over to you, Chennai.
Yes, hi Tendai, hi everyone. Thank you so much for this. It's really needed. My name is Chennai Machinjike. I am a social worker by background and also a community leader, founder of an organization called Empowering Parents of African Children in the UK, EPAC UK for short. And we provide support to parents, provide advocacy support to parents around safeguarding issues. Now, I think I did put in the chat earlier that this research is really relevant because it just goes beyond statistics. These are real issues that parents are facing. There is a real intersection of issues here, and a lot of those issues are systemic. From the work that I am doing, I very much am promoting culturally informed support for migrant children. And speaking from my own experience, one of the biggest issues I am finding is the impact of no recourse to public funds on families and children. And as highlighted within the report, this is a huge concern with the proposals to extend the period of leave before somebody can get indefinite leave to remain. I have highlighted sort of like a number of points where this can really affect children. And I know Dr. Hillary's touched on that a little bit. So one of the points I wanted to raise is, there seems to be a very clear contradiction within this policy in terms of children's rights and how children's rights are applied. In this country, they say every child matters, that safeguarding is everybody's responsibility. However, the NRPF conditions limit the level of protections that are afforded to migrant children, especially. And this policy really highlights that concern. I specifically work with families who have children, older teenage children, who most are wanting to go into higher education. They're not able to access that. As one of the lived experience speakers have said, as they have to pay international fees. A lot of these families are on low income. You also have, those children who have significant disabilities and additional needs, and their parents aren't able to access the support that most children are able to access. And all of these things really impact, and I'm pleased to hear that there's a representative for employers on this platform, because this is one of the points that I have raised, that employers increasingly need to recognize some of these pressures on their workers and be in a position where they really support them. So as I've already highlighted, it's really important that we have this research that shares real lived experiences from people, because the policymakers, a lot of the times, they just make these decisions from paper, in response to maybe, in response to sort of like the public. When things happen, as we know, a lot of things will be blamed on immigration. And some of these decisions are really driven by this, and the people that are really affected by some of these decisions usually go unheard. So, really important research that you have done here. Thank you.
Thank you so much, Chennai, for bringing that important perspective. And we will definitely unpack more. I'm going to also give this time to Danai, but before that, I also want to acknowledge the presence of our friends from Skills Migrants Alliance, if that's correct, Sanchita and also Rahul. They representing their communities as well. So and they're also in support of this report. We managed to share the report with them prior, and would love to hear your views if you can at some point later on during this presentation. Danai, over to you from Health and Social Care Providers Network.
Hello, everyone. Good afternoon. Thank you for inviting me. Can you hear me?
Yes, we can hear you.
Okay, great. This report has been very vital and it's been very important for a lot of employers because as Health and Social Care Providers Network, we have the utmost belief that our workers are the backbone of any business. And as such, a lot of our members have reported the impact this has had on their services. So a lot of the migrant workers that are employed by our network have also been going through the motions of dealing with the impact of this proposed change. So a lot of the mental health issues have affected how workers have shown up to work, and the financial stress and the burden of not knowing how this will actually impact them. And because a lot of these things, whilst they are just discussions, they're a political tool for a lot of people, issues for everyday people. So as part of our organization is we seek to make sure that their voices are heard. And unfortunately, this is one of those that has left a lot of them in predicaments that they are not sure of, because a lot of their workers, because of the uncertainty of these proposed changes, have reported that a lot of their workers have one way or another been affected, which in turn has affected how they work. A lot of it is, we have found that the lawmakers are so far removed from everyday life that they don't actually realize the impact this has on employers like ourselves. So one of the proposed changes is because of the way how much time they want to extend to everything, for us as, as employers, the impact on not just the taxes, the infrastructure that we now have to put in place just to be able to accommodate these changes are very detrimental to services, especially when, for example, a lot of the workers have been talking about how the uplifts haven't been able to meet the demand in terms of the disparity between how much the employers are making and then how much we have to give the employees. So these changes are not just affecting the people on the ground, they're affecting how also employers respond to this. So for example, while a lot of the employers are keen to take on some of the displaced migrants, but because of the changes, because of the not guaranteed workplaces for the hours and everything else, it's making it very difficult for a lot of employers to even want to take on those displaced workers, because there's no way where we can guarantee them any work. So these changes we feel need to be very reflective of what's actually happening on the ground. And they are not. The impact on the quality of service we're able to then provide, the quality of carers that we then have to employ is really affected, because people, their mindsets are not on the job. They're worrying about how their lives are being impacted by this. So you'll find that where someone was very focused, they're losing concentration at work. They're worried about their family. They're worried about their finances. And in turn, a lot of employers are facing a lot of mental health issues with their staff, people phoning in sick. And then in turn, as an employer, they have to report all of these changes to the Home Office. And in turn, it's also affecting how the Home Office are even responding to us as employers. So I think the report is very important that we highlight the things that are happening on the ground. And organizations like Tulia help us to be able to navigate how we guide our employees and employers. Back to you, Tendai.
Amazing. Thank you so much, Danai, for sharing that and how you're also finding it on the ground. So the themes that are coming out is, the mental health stress that the migrants would have to go through because of these changes, and how sometimes like the policymakers, they just make rules, they just change things, but then they don't appreciate what is actually happening on the ground. So, some of these things have been picked up in the report, like what Dr. Hillary had said, has shared the main themes, which are, care workforce instability. I think it's coming up from Danai's, contribution, things like migrant exploitation, family separation, and also, mental health crisis. So those are really, really important points. I'm going to pass on to Rumbi Funzobaya, our founder.
Hi, I'm not going to say much. Thank you so much, Tendai, and thank you everyone who's contributed. And I think there's a lot of work to be done continuing on from this. One of the areas that I just wanted to touch on is that in addition to the proposed settlement changes to increase the settlement period to 15 years for carers, so this report is not focused on all the skilled migrants. It's a report that's focused only on carers who are working in the health and adult social care sector. And alongside the proposals, there is also such an increase in sponsor license revocation. So there's a lot of fear that is around sponsor license revocation. And the numbers of sponsor license revocations last year were almost 3,000. And the sponsor license revocation doesn't just affect the business, it affects the workers and the families who are at risk. And so thinking that the settlement period has increased, will potentially increase to 15 years for carers, because carers, the period is not 10 years, it was proposed to be 15 years, which is longer than other sectors as well. And with the level of revocation, it places employers operating under pressure, not knowing what the future holds for them. And we've seen many employers saying that they don't actually want to sponsor migrant workers anymore. They would rather just focus on scaling down their businesses or completely leaving sectors that require like domiciliary care workers and focusing on other areas, which then affects service delivery and affects the council, and they're there to commission services and to look after the elderly and the vulnerable. But if there's no workers, then it's going to have a ripple effect. So we've been working to support displaced workers and signposting them to organizations and helping them at our drop-ins. And the level of revocations, even at extension, is causing so many difficulties for people when they're trying to extend their visas. Then the sponsors are not getting the undefined COSs to enable them to sponsor. We've seen a marked increase in digital compliance checks, at extension time. And all of this is causing such a high level of uncertainty for the workers and their families. And the increase in the financial cost to employers is very, very significant. And we see that things, instead of getting better, are just going to get worse because of the knee-jerk reaction, where the policymakers are reacting perhaps to political pressure. We know that the results of the last local elections have been just really alarming, and the uncertainty in the Labour Party as well as a result of that. It has a ripple effect, and at the bottom of it, at the end of it all, our families and the people that we serve who are getting affected. And we see that on a daily basis. And therefore, the work that we have to do is ongoing. The work that we have to do cannot stop. We have to continue speaking, advocating, challenging. And it may be that policies will be implemented, but we have to challenge them. We have to continue to speak out and we cannot stop. And one of the things that we've seen as well is carers leaving the UK, going to Canada, going to New Zealand, going to Australia, going to other countries, or back to their countries of origin. But what it leaves is still a vacuum in the sector because the sector is still understaffed. So it feels like we're going round and round in circles. And it's frustrating. There are people at the bottom of this, and therefore we need to see changes. Thank you.
Amazing, amazing. Thank you so much, Rumbi, for sharing that. So before I go on to our next segment, which is question, answers, and comments from everybody else who would like to contribute, please feel free to use the chat feature. It's open throughout this session. And like what Simon said, so it may look like we're not able to help now, but we are listening, and a lot of work is going on in the background. So one of our guests who was supposed to join the panel, Dr. Las Mafuba from Inini, she sent her comment and her contribution, which I'm just going to read in a while. She's just said, firstly, I want to congratulate Tulia Group for producing such a timely, courageous, and deeply important report. Moving the goalpost does more than present data. It humanizes a conversation that is too often reduced to policy headlines and political rhetoric. Reading this report through a mental health lens, what stood out most powerfully for me was the psychological impact of uncertainty, conditional belonging, and prolonged insecurity on migrant care workers and their families. We cannot separate immigration policy from mental health outcomes. When people live with constant fear of losing their status, being unable to reunite with family, or feeling trapped within exploitative systems, that has profound emotional, psychological, and social consequences. The report highlights something many of us working within migrant communities already witness daily. Like everybody has said, that insecurity creates silence. People become afraid to speak up, afraid to challenge unfair treatment, afraid to access support, and afraid to fully participate in society. Over time, this affects confidence, identity, well-being, relationships, and trust in systems and institutions. What is particularly striking about this report is that it exposes the contradiction at the heart of the current debate. Migrant care workers are essential to sustaining health and social care systems in the country. They provide care, dignity, compassion, and stability to some of the most vulnerable members of society. Yet many continue to live with instability themselves. So the report also speaks to the emotional burden carried by families, the pain of separation, uncertainty around settlement, and the inability to plan for the future are not simply administrative issues, they are mental health issues. Chronic uncertainty affects emotional well-being in ways that are often visible but deeply damaging. So, as someone working in migrant mental health and community well-being, I believe this report should be taken seriously, not only by policymakers, but by healthcare systems, local authorities, employers, and wider society, because ultimately, policies that produce prolonged fear, instability, and exclusion do not just affect individuals, they affect communities, workforce, stability, public trust, and social cohesion. Thank you, Tulia Group, the researchers, and all participants who shared their experiences so honestly and courageously. This report is an important contribution to both policy and public understanding, and I hope it helps to move the conversation forward for fairness, humanity, and dignity. That's Dr. Las Mafuba from Inini Initiative. She's the founder and the CEO. So, thank you so much, Dr. Las in absentia. I'm sure she's going to watch the recording at some point. So yes, Rahul, did you want to contribute something? Sanchita?
Hello,
Hi, Rahul. How are you? Welcome.
I'm all right. Hi, thank you. Good afternoon, everybody. Well,
Tulia.
the thing is, I just wanted to highlight on one thing. Like, these policies which the government is announcing now, they say that, people have come here, paid money, and got visas. But there are a lot of people who have come here on different type categories of visa. For example, a student visa, then worked in a care home, and then got their sponsor license. Yeah. एक मिनट मामा है. And so this is doing is this is being very unfair on these people who have worked their heart out and got the sponsorships, and now the changing the rules retrospectively is not fair, is what I feel. And also, after being on this visa for years, we have also planned our life. We have taken financial burden on our head, which if the government does it retrospectively, tomorrow the sponsorships, the company won't sponsor us, because of course they don't want to sponsor us if they say we are in a loop of finding other sponsors, and then who's going to take the responsibility of the financial burden which we are already in? It's so unfair. And also I'm seeing that nobody is actually talking about the compensation part. If at all the government goes and goes ahead with implementing with these policies retrospectively, and if we choose not, we don't want, because we were promised ILR in 5 years, and we don't want to slog for another 10 years. And then what are the compensation that government will give us if in case we don't wish to stay here back in the country? Like they say, people are coming and because they want to stay in our country, and that's what they are saying. But wherein it is not the case, we are working hard, we are paying our taxes for years and years, and now they are telling us to go out of the country on the basis that we came here and took their jobs. It's so unfair. I don't know anybody who's willing to work, any of the youth of Britain who's willing to work in care homes doing the work we are doing. It's so unfair. People have to talk about it, and they have to take a data of they say that the youths don't have work. Well, let me ask, how many youth from the Great Britain they are coming and willing to work in care homes? Nobody, none of them. I have friends who are British. They don't want to work. They tell us you are being underpaid. You don't have limited number of hours, and the government is saying that you can only work 40 hours in for your employer, and another additional 20 hours for another care home. Now, when we apply for jobs in other care homes, they say that we can't take part-time jobs. If you have to work full-time, it's so difficult. I have given hundreds of interviews, but no, they say that we need full-time workers. We don't need part-times. So how is it fair for the government to say that we are giving you an opportunity to work extra, but it has to be on in some other care homes only? Is so unfair. And they say us, or it has to be in a higher level of skill work. How are they going to take us? It's not even practical. So my question here is, if they intend to apply the rules retrospectively, we should also force them to allow us our freedom. We are, as it is, not here to take their benefits and all these things. We are here to work, and we are here to take what we deserve. Thank you.
Thank you so much, Rahul. That is extremely unfair, as you have said. Thank you for your contribution. I'm not too sure if Sachita would like to also contribute. I know they've also done their report and they're probably working on something as well. I don't know if Sachita, if you'd like to share on that.
Yeah, thank you. Thanks for the opportunity. I just wanted to say big thank you for the Tulia Group for organizing today report launching, and yeah, for the important work they continue to do support migrant workers like us and their families in the UK. Also, thank you all main speakers and researchers, including the doctor, for the amazing support, and he shared the findings today. Everything was explained clearly, and most of the key issues have already been covered in detail. So, yeah, we are Skill Migrant Alliance, and Tulia Group. We are always happy to support all migrant workers as well, and yeah, we will always continue to support, and we will listen to their voice and stand for fairness, dignity, and for a better protection. And thank you for that.
Thank you so much, Sachita, for that. And, thank you everyone for listening in and for sharing your contribution. So I think I'm just going to have maybe the last 2 to 3 minutes to allow people to share their thoughts, their comments, any policy recommendations, question and answers. This is the platform. And then we'll have a close. We aim to finish in a moment. Is there anyone who'd like to share? You can either type or just raise your hand and then I will pick on you. Or any comments to the presenters at all? I know some haven't read the report. We've just shared the report in advance to all our speakers and some of our community partners. But with everybody else, the report will be sent out soon after this meeting. Perfect. Thank you very much, everyone. And I'm sure some have already shared their contributions throughout the session, which is really, really great. So I will also open this platform for anybody who's got, as much as we had our policy recommendations from our slide from the doctor, is there anyone else who would like to share maybe what they would like us to put forward? Because like Rumbi has said, this conversation is not just ending here, but there's like a launch to, the bigger work that we're doing to share your thoughts and your voices. Right. Okay, great. Oh yes, and welcome to Unison. I'm not sure if they managed to join, but yeah, they were also aware of this event. I'm going to ask Omar. I'm just going to give everyone 30 seconds because I know we're supposed to finish at 12:30, so about 3 more minutes remaining. Omar, are you able to unmute? And then just for 30 seconds, please, and Naomi soon after that.
All right. Thank you very much. So basically, I just wanted to add, I love the presentation and I think it has captured everything. I was reading somewhere in the government recommendations where they were saying, oh, even though there is going to be a retrospective implication is going to cover those in the NHS and public sector. So the government, in their own eyes, are looking at care workers who are contributing value as only those who work in the NHS and the public sector. Then all other care workers are nothing, are like figurative numbers or are like those who came in through the boats. This should not be the case. And so if there is a sector-wide recommendation, if there is any recommendation going forward, it should affect everyone in the care sector, not whether you work, not everyone can work in the NHS and not everyone can work in the public sector. We have majority of care workers who are making major impacts are even outside the NHS. Majority of those who create more value within the sector are located outside the NHS. So in the government eyes, everything for them starts and stops with the NHS. And this should not be the case. And so if there is going to be any implementation or anything, whether retrospective, whether transitional period, it should cover everyone. And in the first place, they should not even implement this kind of policies because it's wickedness of the highest order. But if they still decide to go ahead with it, which I'm hoping they don't, then there should be a transitional policy that will be implemented for everyone and not only those within the NHS or public sector. Thank you.
Thank you so much, Omar. We've taken note of that. Yes, go ahead, Naomi.
Yeah,
30
thank you.
seconds, please.
Thank you so much. Thank you so much. It's just a quick reminder to Tulia. Um, thank you for the good work that you are doing, but I think there's something wrong with the registration and the sending of links because I kept on being told that Tulia will send me a link to join the meeting, which I did not. I ended up looking for WhatsApp and sending WhatsApp numbers. And also, I don't know if we have something like this. A lot of people wanted to join, and I had shared with a lot of people who were now bothering me for the link to join the meeting. So I don't know how best we can do this so that more people will be part of this great work that you are doing. Thank you so much for everything.
Oh, thank you so much, Naomi, for raising that. Sorry, apologies for that glitch. I think we tried to resolve that as well. But yeah, we'll work on improving next time. Thank you for the feedback. And yes, Unison is here. Coventry Unison, thank you so much for joining. You know, they're always supporting us, and you know, they're always, you know, taking what we're discussing here forward in their different spheres of influence. So please, everyone, I'm going to assure you that, you know, what you've said here, this presentation here is not just a presentation, but there's so much work going on behind the scenes. And thanks to even the Coventry team, I know the migration team, they were here, and the whole team, thank you all for supporting us and for always supporting us. And I'm sure you've taken note of, you know, certain things that we've discussed and all the community groups, everybody. Even we may fail to like name each and every one, but really, really appreciate. What we can say is go ahead and, you know, do the best that you can. You've all heard for yourselves what people are saying. And yes, we're taking note of everything. You still have anything to say, just put it in the chat. We'll definitely have some time to go through everything and move forward. Maybe, I don't know if Unison would like to share or any representative. I know they have got an upcoming campaign going on. Would you like to share, maybe? If any representative from Unison would like to share at all.
I've
Okay,
seen
that's all.
I've seen a comment that they've put in the chat that Unison are very involved in campaigning and lobbying the government on all the issues discussed today, and they have been. And some of our members joined the Fair Visa campaign in December and went there. And they've said we encourage everyone to join and get involved. Our voice is stronger together, and to join the union because I know Unison is doing a fantastic job. So yeah, we can't hear you. Sorry if
Oh,
you
yes.
unmute. Yeah.
Sorry. Please do
Hello?
unmute.
Do we don't know what's wrong.
Hello, Mrs. B.
Hello, yes?
Yes, yeah.
We're
Is it?
trying to hear
Someone
Unison.
from Unison wanted to speak. Let's see if I can try to prompt them to unmute. Okay. I think they probably been booted out, but that's okay. Unmuted. Oh, okay. Oh, it's all right. No worries. Thank you so much. I really, really appreciate
People
that.
should join the union if you're not a member of a union. Yeah. Join.
Yes, please do join a union. We've got so many people who call Tulia asking, you know, they will be in problems, and then now they need help. Our first question, are you part of a union? The answer is no. So, I mean, sometimes it's best to just join, even when you don't need it yet. You might need it at some point. So please do join a union, Unison specifically. All right.
Hi,
Yes,
Tendai.
yes.
Hi. Before we close, there's this one question that came up on the chat, which I believe most of us will be having, because all of us here want to bring our voices forward. So the question reads, how do those in care raise their voice and be heard without fear of being victimized? So how best can we put our voices forward without the fear of being victimized? This is something I'd like to um, put forward so that all of us here can voice out practically.
Join a union.
Yes.
I think join a union, get support, get advice, and exercise wisdom. Exercise wisdom. I always say that to people that exercise wisdom in 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 everything that you do, but definitely join a union because you get support, you get protection, you get people to back you and speak for you. So definitely get join a union. Yeah.
Can I just add there as well? If if the organisation you're working for is commissioned by the council, then talk to us. Myself and a colleague are going to meet all the international workers at a company in Coventry next week who we commissioned and we council gives money to. They have had no objection to us meeting the workers, and they've arranged for all the workers to come in on a particular day. And we're going to meet them in private. We're going to talk to them as a group. We're not fishing for anything. We're just asking people how things are going. How can we help? You know, do they need access? And this comes back to my earlier comment that a lot of the people who are working are quite invisible to us because you have no reason to talk to us. You've got no reason, you know, if everything's going quite well at work, you've probably got no reason to talk to us. And we do talk a lot to the people where things aren't going well. So we're making a bit of a concerted effort now to get round the organisations that employ a lot of international workers and spend a little time with those people because we're conscious we don't hear from you very often. So, you know, if you're working for Esteemed Life next week, my colleague Joe and myself will be there and have a cup of tea with you and just say what's going on. You know, talk to us about this organisation. Sorry, my voice is going still. You know, we'll feed back. We'll feed back to the employer, positive and negative. You know, if we think they need to change something, we only really have that power though in organisations that we commission. So a lot of independent care organisations, we can't really get in there to do that. But as part of our contract monitoring for the organisations we do commission, we can say, hey, we want to come and talk to your staff. They don't have to agree, but it doesn't look great if they don't agree. So, you know, so if you do work for Esteemed Life, I don't mind name dropping them because they were quite happy to welcome us. You know, try and get in on that day, come have a cup of coffee, a cup of tea, have a chat with us for an hour and tell us about the organisation and what you're going through. And we might be able to organise an event for those who are working, but we need to find out more about you. We need to find out what the problems we've already talked about, no recourse to public funds today, and that is a huge problem. But we, you know, working with our colleagues in the migration team and family hubs, we can try and get around some of those things. There's lots of organisations in the city who will help people who are on no recourse to public funds, and you know, we've ran these marketplace events. I've kind of rolled back on them a little bit. We always get really good attendance, but I'm conscious I'm asking organisations to spend a lot of time standing in a room talking to us. So trying to make it a little bit more targeted for the time we've got left. Hope that helps. But yeah, do talk to us and certainly do join a union. We're in regular touch with Unison. We talk to Tulia a lot. We swap information. We talk about modern slavery. We talk about bad working practices. We've also got very close links with the police. Not the kind of police that turn up when you're drunk and disorderly outside a pub, but the police who do a lot of intelligence around modern slavery and a lot of kind of, you know, they're a kind of investigative. I can't even say it, so it's gone. But they're an intelligence gathering team. They're very approachable. They're a good barrier in if you've got serious concerns that you're being abused or your rights are being curtailed. And we or Unison or migration team will introduce you to the police if we think you need to go there. Or you can turn up on a little Park Street police station and talk to them, and then their meet and greet team will make sure you get in touch with can't remember what the actual name of the team is now, but I will find out and pass it over to Rumby and Tendai so they can publicise it. But they're really good, you know, they understand the situation. So they're not frontline police, they are police who collect information. So you know, there is lots of support out there. Lynch just mentioned Royal College of Nursing. Yeah, they're really good as well. So there is lots out there. If you want to send us an email at the IR email address, or the guys at Tulia and Unison have got my email, we can link you into our list of people. Excuse me. We can invite you to things. Feel free to contact us, and don't ever ring us up though. I always say please don't ring me because I get so many calls. Send me an email, I promise I'll get back to you. I don't want to I'll just forget phone calls. I don't want to disappoint you if I don't call back. But yeah, keep in touch.
Awesome. Thank you so much, Simon, for that. Really, really appreciate all the work that you do. And I would like to also acknowledge Lean from the Warwickshire County Council. You're welcome, Lean. Thank you for your support as well. She's shared information there. If you have any concerns in Warwickshire, please contact International Recruitment at warwickshire.gov.uk. They can support you. And also, she's also mentioned Royal College of Nursing. They've got a great support network for international staff, nurses, and support workers. So that's some information that you can get. And also, don't hesitate to contact us at Tulia. So, Tulia, if you're getting to know about Tulia for the first time, we're an immigration community interest company based in Coventry, although we offer our services online. You can access us from anywhere in the world. We can help you with immigration advice. We can help you with holistic support, advice that goes beyond, oh, my visa is expiring. We want to know, okay, so what's your family like? What's your situation like? And we can signpost you to different organizations and partners that we work with. And beyond that, like what we're doing, we also do advocacy work. So this is part of our advocacy work where we're doing research and we are, presenting our findings to the government and hoping for better policy change. So thank you everyone for joining. I won't keep you for long. I'd like to appreciate all our panelists. Thank you, Chennai, Danai, Dr. Hilary. Thank you, Rumbi, Simon, and everybody else who contributed today. Sachita, Rahul, we really, really appreciate. Please don't stay silent. Keep talking because, other people are watching and they are listening. Thank you very much, everyone. Have a good one. We'll send the report to everyone and also on our website, www.tulia.org.uk. Thanks, everybody.
Excellent. Thank you. Thank you, everyone.